Hello again, thank you very much for joining us. And we begin from the former Communications Minister, Dr. Edward Omanibuama, who has called for special training for physicians in training to handle emergency situations as the number of Ghana's COVID-19 cases increase. Ghana's case count now stands at 2,000 with over 2,000 with 18 deaths. Speaking on the Super Morning Show a while ago, Dr. Omanibuama explained why Ghana's recovery cases and deaths are low.
Our health systems are not as robust and strong, resilient, adaptable as that of the countries that I have mentioned. And you can imagine if, God forbid, it should never happen to us, if we have 50 or 100 cases that require emergency care and that require ventilators that will be dedicated to them. Let's not forget, we cannot also assign all the ventilators in the country to COVID-19 patients who need them. So whilst we are at it and looking at all these, we need to plan. And if you also look at the trajectory, our numbers are rising. Unfortunately, the curve, the graph that we see is not too helpful in terms of predicting whether we are dropping. In terms of dropping, we know we are not dropping, we are rising, but plateau, because there was a point that the graph had shown a certain horizontalness, which elsewhere they would have said, oh, we are plateauing, so it looks as if.
But then we started rising again.
It's because of the inherent challenges in the way our testing system is being managed. So at best, you can put the overall effect of the stepladder graph that we are seeing together and say that, look, the cases are increasing. So even if the mortalities are low here, even if the number of cases that are developing the crisis are lower than the expected percentage, the rise will definitely impact on the total number that will need emergency care. And because of our peculiar situation of having just 67 ventilators within the entire public system, minus the private sector, and maybe if the 20 that a government said
they've ordered,
they ordered are in, then maybe we have 87. So you can imagine what will happen. It is not just also about ventilators. If you're looking at health systems, it's an overall thing. It's about infrastructure, it's about the equipment, and most importantly, also about the human resource. Do we have enough anesthetists? The kind of Prof. Dujanfi, Dr. Chris Owu, Dr. Cornelia Kwaku, Pum, and several others who can really, on the spur of the moment, take charge and respond to the needs of such critically ill patients. Do we have enough respiratory physicians like Dr. Audrey Forson and a few others to take charge and respond to this? Perhaps we should also be looking at quickly shifting some physicians in training, or even some who have completed their training, and giving them crash courses in emergency medicine, awaiting
the arrival of more ventilators.
A remote possibility, which we all do not pray for. So I say that the numbers in terms of deaths are lower compared to the cases that have been confirmed, but because our trajectory is on an upward trend, we need to be careful and not just relax.
Doc, why are the recoveries also so low?
The recoveries, we need to also compare carefully. Unfortunately, but that is what can happen. The standards that are being used vary. So if you decide that in terms of recovery, you are not going to use additional tests, and if those additional tests are negative, then you conclude that the person has recovered. Mm-hmm. But you are going to use symptoms abating and the person being determined as cured at the end of 28 days, at the end of 21 days and all. One may be recording higher recoveries, another may be recording lower recoveries. Right. Let me cite an example. South Korea has recently realized that what they mistook for reinfection was rather fragments of the virus that the PCR had picked in those cases, and so they felt they had been cured. They went back into the community and got reinfected. You understand? So these can obliterate the numbers. Be that as it may, there are still human beings to these numbers, and that is the most important thing. Yeah. Whether low or high, one death is important because it is a father, it is a mother, it is a child, it is a chief, it is a queen mother, a teacher, a doctor, a lawyer, a journalist, a farmer who may be dead.
Now, away from that, Volta region has recorded 30 positive cases of COVID-19, with 21 from Ketu South. This has put many districts on the alert to prevent and manage, to put in preventive and management measures in place. Central Town District in 2 weeks will hand over a case management center to the Health Directorate in preparedness towards a possible positive case in the district. The center, which is situated at Mafi Aofe near Mafi Kumasi, has 8 self-contained rooms under one building, which caters with caterers on standby, as well as other staff of the hospital to provide services to any affected person.
So this is the case management center here in Mafi Aofe in the Central Town District of the Volta region. This is the place where people who are or might be tested positive will be brought here to be managed or be taken care of here. Already they have an isolation center at the Dome Government Hospital where if should there be any case, people can also be.
I see the whole Ghana as one district under this COVID-19 thing, that we should all put our resources together to manage this. So should we make the place available and we don't have any positive case and sister districts have? Why not? We can make the place available and even extend our support by way of feeding them. We want everything localized, that those who will come here should take everything local food, not that going to hire the service of any caterer to give them food that they may not like. No, you have all the facilities here, a changing room where the caretaker should be, a caterer that will cook for them anything they need at any point in time. They should be able to get it so that they feel at home. That will even enhance their treatment. That's what we are looking at. So any other person, any other district that might fail to have a case and come and use any of our rooms, we shall be ready to give that hand.
Oh, so for now, the 21 people that were quarantined some time ago have tested negative. Central Town is taking the lead in the region to have a management center for any possible positive results here. For now, we just hope that there is they don't have any positive results or any positive case here in the Central Town. That is what the residents are praying for. And the district is also intensifying education, especially for the market women and boat operators on social distances and face mask wearing. My name is Ivy Satoji for JoyNews.
Wash your hands regularly with soap and running water. This is probably one of the most commonly used phrases by health authorities since the outbreak of COVID-19 pandemic. But how do you wash your hands if you don't have access to clean water? This is the plight of the residents of Atebubu in the Bono East region, and JoyNews' Anas Sabit was in the community and has come through with the following reports.
Regular hand washing with soap and running water has been highly recommended by health authorities so far as the prevention of the COVID-19 pandemic is concerned. However, here in the Atebubu municipality of the Bono East region, what you see behind me here is the major source of water for the people staying around this particular vicinity. Now, the people have two options: to either regularly wash their hands with the little water they have, or save it to be used for domestic purposes. Ideally, everyone will choose to drink from the little water they are having. That is the plight of the people here. We're interacting with these people this afternoon to find out how they are coping with the unavailability of water in the era of COVID-19.
Because this water is important to us, and it helps us a lot. Because without this water, there is no table. And the water we are using, that's the water the animals too are also using. And it is fertile to us. It brings a lot of disease. Because when we look, this water, time of rainy season, it carries a lot of feces to the water. And we are also using the water.
In an era of COVID-19, we are being told to regularly wash our hands with soap and the running water. Are you able to do that once getting water is difficult here?
We are not practicing it because we have shortage of water. Where are we getting the water? And then where will I get the water and wash our hands? So we are not practicing it at all.
You step in the water with your feet, put your hands in it and then fetch it for drinking, washing of hands, and etc. Don't you think people will even carry virus into the water in this coronavirus season?
Yeah, people can carry virus into the water, and we can't do anything to stop them.
True fact, because there's no any protection agencies here. If someone is with this virus, you never know. So the virus can carry into this water easily.
While residents here may want to follow hygiene guidelines necessary to stop the spread of the coronavirus outbreak, access to potable water or lack thereof is preventing them from doing so. They, however, have a simple but necessary plea to authorities. Reporting for JoyNews, Anas Sabit, Atebubu.
Let's stay on COVID, but move to the senior high schools now, because some heads of senior high schools in the central region are calling for periodic fumigation exercises in the country schools to get rid of bedbugs and other insects that disturb students. At the start of the fumigation exercise in 103 senior high, technical and vocational schools, the heads today told Joy News they are relieved with the intervention. Richard Kujinakum has more in the following report.
Bedbugs, small oval brownish insects that live on the blood of animals and humans, have tormented students of senior high schools across the country for a very long time. The insects, plus others such as cockroaches, left a huge burden on authorities of the schools and parents because of how their activities affected them. Heads of senior high schools in the central region have heaved a sigh of relief after the GES commenced their fumigation exercise in 103 senior high, technical and vocational education and training schools in the central region. Headmistress of Holy Child School, Anastasia Tomford-Ochre, the head of Wesley Girls Senior High School, Kay Opon Ankuma, and her colleagues want more of these done periodically to fight not only COVID-19 but also bedbugs in the country's senior high schools.
Students have been battling with the bedbugs for quite some time now, and we've been crying for help, and I think that our cries have been heard. And yes, I must say that this is not the first time anyway. This is the second time. And we wish that this will continue so that the bedbug menace will be completely rid of in our schools. As a girls' school, you know, girls are delicate and we need to protect them. So this is, I think, one of the ways of preparation to protect them when they come back to school.
Oh yeah, one of the major challenges as a school, you know, dumb bed bugs, even mbwatan and other rodents and insects. Oyaza, Ohauhen, Ankasankasa. We would like to commend the government and the Ghana Education Service especially for this particular, you know, measure that it has put in place and all other measures that have been put in place to combat COVID-19.
Chief Corporate Communications Officer, Just One Group of Companies, Sophia Lisa, believes a disinfection arrangement such as this could be done periodically to fight bedbugs.
For this fumigation, the chemical is so potent, it's strong. It's able to last for up to 6 months and beyond. So we are believing that, thankfully, hopefully, the students will come to school very soon. And by the time they are coming, the system will be clear and the chemical will linger on for a while before we have to come back again to help. It's a very good exercise that I think that even after the contract is over, teachers and PTAs should encourage schools to continue to do this.
Central Regional Director of Education, Martha Owusu-Agyeman, is upbeat the exercise has been organized at the right time and she is confident it will create a congenial atmosphere for the students when schools resume.
With COVID or without COVID, the bedbugs were there. So it's good, we are doing it. And for me, I'm happy because for now, the students are not here. They've been away for a while. And when you finish too, they are not going to come tomorrow. So there will be enough time for the chemicals to work.
The Ghana Education Service has contracted the Zoom Lion Company Limited to help in the nationwide initiative. Government has over the past weeks undertaken similar exercises in major and satellite markets across the country. Ministries and other government departments have not been left out of this operation. Richard Kwejenyako, Joy News, Cape Coast.
And we're going live to the central region now to get an update on this fumigation exercise. Richard Kwejenyako is our man on the ground and he joins us via phone. Hello, Richard. Thanks for joining us here on News Desk. Which schools have benefited from this exercise already?
Well, so it started on Saturday, St. Augustine's College, Infantipim, Wesley Girls, and other key schools benefited. So 6 schools benefited on Saturday. Today they are doing 4 schools, and tomorrow they will be doing 4 schools. In all, 103 schools in the central region are going to be to benefit.
Okay, so 103 schools will benefit. What is the extent of the exercise being undertaken in terms of the fumigation? Which areas are they focusing on?
The country for a very long time, the insects.
What we are doing is going to make the environment safe for our children who are currently at home. That by the time they are coming in, the schools will be safe and healthy for them to concentrate and do whatever educational programs they have to do. Additionally, it's also going to help to make sure that they are able to concentrate very well and study and be able to feel healthy. And the challenge with the good news about it is that, you know, COVID-19 attacks our immune system. Now, with this, if the bed bat is there, it's going to worsen it for them because it weakens your system and you can easily be attacked. But with this disinfestation, it helps you to build your immune system. Once you are eating well and all, they will be okay. And then once they are, and it's not exclusive, but then you have to be practicing the COVID-19 protocols, washing the hands with soap under running water for not less than 20 seconds, you know, using hand sanitizers, practicing social distancing, and using the nose mask, which is very key. The children will have to do that as well. But the other thing is that this particular chemical that we're using has a potency level of up to 6 months. And so from now to the next 6 months, we are sure that the system is clean and clear. But we want to advise school authorities that this is something they should be doing constantly, because the bed bat is a very dangerous and very sneaky, you know, pest, and it has its way of getting back into the system. So if you don't do it quite often, you can't say that I have done this one and that is it, it's not coming again. It can come again because people bring it for their homes and other places. So we want to encourage school authorities to take this seriously and be doing it quite often.
Is it going to be a regular feature? Looking at the cost implications, are you going to collaborate with the school authorities? If
they call us anytime, we are there. We are an entity that has what it takes to do the work. So if they call us, we'll be happy to come and help them. I know that some of the schools have been doing it, but oftentimes they're not able to do the entire school. Most of them will do the dormitories and maybe classrooms, but we have to cover the entire school's, you know, structure because of the cost involved. But we are available anytime the Ghana Education calls us, anytime any individual school calls us, we are ready to come and help.
Before the student left, they were having some food items. How safe is it?
And so that's Sofa Lisa. She is head of corporate communications for the Jospon Group, leading this initiative. My colleague Kojo Nako is still with us on the line. Kojo, I heard her talk about the fact that they are covering the entire school, not just the dormitories. What have they found during this period of fumigation, and what advice are they passing on to the school management?
So before this disinfection exercise, the heads were battling with the issue of bed bugs. And for them, it's a good exercise that is coming. But what they are saying is that they want it to continue. The Zoom Lion Chief Corporate Communications Officer indicated that this exercise they are doing has a 6 month duration. And so after that, then the schools will have to take some steps in order to continue the fumigation exercise to get rid of the bed bugs completely. And so the schools are excited and they want more to be done. They are asking government to support them to ensure that the schools in Ghana are rid of bed bugs.
And she mentioned cost. Are the schools bearing any cost for this?
Well, the schools say they do not have adequate capacity to continue doing this, so they are going to rely on government, and particularly the Zoom Lion. But Zoom Lion says that, well, they are there, they are a corporate entity, and so if government invites them in to fumigate the schools, they are in already. They have also indicated that government has signaled that they are going to continue with the exercise, and so that is what is meaning for the schools and the Zoom Lion. I
know that some of the schools earlier had concern about their schools being turned into isolation centers. What is the latest on that?
Well, so as we speak, there's been some backdoor engagement. The issue had to do with community entry protocols that were not adhered to. They were not engaged. That is what the the schools and the communities were saying. But now, I think the joining has gone on well, and so now there is no cause for alarm. The schools are allowed, but I do not know, for now, we do not know which schools have accepted that their schools should be used as quarantine centers or isolation centers. But we know some schools that we have some people already there, they have been quarantined in these centers already. And just before you go, could you tell us about the social distancing protocols, the use of face masks, which is mandatory now? How are the people observing that? It is a very difficult and a tall order for a lot of people, especially at the market and the fish market. I have been going to the Elmina market, and it's really a difficult task for them, knowing the kind of community that that place is, and then the market as well. But the chief executives and the authorities are ensuring that these things are adhered to, and so they have sent task force teams to go around to ensure that all of these things are strictly adhered to. Already they've indicated that taxis are not supposed to pick their normal four. No one sits in between another passenger, so the taxis will have 4, and then the tricycles and the other things, they are supposed to pick 2. And so the police are regularly on the road to ensure that these things are strictly enforced. Richard, thank you very much. Richard Kojinako is our Central Region correspondent, bringing us up to speed on the fumigation exercise which is underway in the region in senior high schools, technical and vocational schools as part of measures being put in place to help prevent the further spread of COVID-19.
Hi, good morning. Welcome to Business. My name is Darrell Kwao. The Ministry of Food and Agriculture is urging farmers across the country to adopt preventive spraying to ward off potential invasion by fall armyworms. Earlier this month, the ministry sent a release to caution farmers about a resurgence of the destructive maize pest. Director of Plant Protection and Regulatory Services, Dr. Felicia Ansamprofi, warns farmers to take education on the worms more seriously. She spoke on a visit to persons in the food value chain in the Ashanti region. Nanaya Ojima has more in the following report.
Preventive spraying is adopted to protect maize farms against fall armyworms and other pests. Dr. Ansa Amprofi warns farmers whose farms share boundaries with infested plantations risk losing their crops if they fail to heed advice.
You have a period of about 3 months for the maize to mature before harvesting. So during that period, when you do the first spraying, you don't have to rest. You continue monitoring. After 2 weeks, you go back and see if it's still there. If the infestation is still there, you have to spray again. You have a maximum of about 3 sprayings for a season. So if you're lucky and the infestation is not high, you could spray once and that'll be okay for you.
In 2017, Ghana experienced her first armyworm invasion, mainly of maize farms. The Agric Ministry has since mounted surveillance for early detection of resurgence. Dr. Ansa Amprofi says some farmers have refused to make use of extension services, even when they have evidence of worm on their farms. She says the ministry will continue to educate them on the issue.
What you are saying is that the government have put in place measures by buying the chemicals that they can use to control the fall armyworm. And this they can get access to when they see the AEAs. So small-scale farmers are supposed to contact the agric officers or the agric offices to ensure that they get their pesticides to spray. But the commercial farmers may have to just follow on our advice and get the right pesticides to buy.
Meanwhile, Sector Minister Dr. Osuefie Akutu says government is working to deal with the pests.
Now, the Institute for Energy Security, IES, has called on government to consider funding the repairs and expansion of the bulk oil storage, distribution, storage and transportation company BOSS with proceeds from the price stabilization levy. The company, according to its managing director, is operating at about 25% of its capacity. Executive Director of IAS, Pakwesi Anamwasechi, who spoke to Joy Business, agreed that BOSS needs new investments to help expand its infrastructure to meet current demand.
We have never been against the BOSS margin increments, the last time they sought to introduce the increments was wrong timing. Fuel prices were going up and we were introducing more taxes and levies. It was a wrong timing. We understand very well and we all know that time value of money is something that is in business that you need to consider. And so this 3 pesos that was given to them or they have today was some years ago. And so the value has eroded over time. So they need to introduce additional one to help them have enough cash to operate. And so we support the increments of additional 3 pesos.
They're looking for somewhere around 9 pesos.
Well,
and haven't seen the infrastructure and all the presentation that has been done,
Well, that's a whole new discussion. If you want to move from 3 pesos to 9 pesos, it won't be bad if you can justify it, because the 3 pesos falls in place, that the value of the existing one has fallen by more than 40%, so not 100%. So let's introduce something in addition. Of course, we have grown as a country, and so we might need to expand the infrastructure to be able to meet the strategic, fuel purposes. And so if we have to move it to 9%, 9 pesos or more, we can look at it. All of us have seen the waste going around, and we need to save the situation. Our concern is that whether we give you 3 pesos or additional 9 pesos, will you put it to efficient use? Because we've seen time and time again where money has been misapplied and money has been applied inefficiently in the bus system.
That's your business update. Sports is up next.
Time for sports, and George is here with the latest. Hello, George.
How you doing,
I'm
Ernest?
good.
It's good to see you.
The leagues are not back yet.
Yeah, leagues are not back. We are managing, and these days we don't fight so much. We had a wonderful interview. I think that was on the Sports Link on Saturday. Joe Addo spoke about Abedi Pele and said, look, Abedi Pele was the best captain ever, the best captain he has seen. Obviously, he played with him, but we've just been wondering what's been going on because, till Joe Addo made these comments, we all felt that Abedi Pele was a very, very divisive figure. Abedi Pele was egoistic. He had so much ego. He felt he was better than the rest of the players. All we're hearing with the Tony Yeboah versus Abedi Pele row, we heard, in the grapevine, cost Ghana.
And even Kwesi Appiah,
the captaincy, and all of that. So, most people are now having to rethink, but others feel that no.
If he was
really the best captain, because for most of us, we've said the best captain of the Black Stars was Stephen Appiah.
I agree, but you see, let's listen to Joe.
Yes,
let's listen to him first, and then we can continue from there.
I went to the Black Stars in '89. Sam Dodu, may his soul rest in peace. He invited me to the team. I was very, very young. I was still playing for under 20s, I think, when I was invited into the team. And Pokunti was the captain, and then it became Kwesi Appiah for a while. And then Bukat Caesar came and changed things and made Abedi the captain. For all my time that I played in the national team, Abedi was the best captain I ever had. He was unbelievable. I mean, he was so disciplined, more disciplined than we. Because we sometimes we joke, we have fun in training, we take it as, it's all right. When he is in camp, everything changes. The way you see him train is the same way you see him play. He doesn't joke. On the field, everybody is his enemy. Even when you're playing 2-on-2 with Abedi and you are on his team, it's 2 of you, and you lose, you are in trouble. He doesn't want to lose. That was in his nature. So there were things that he did that was like overbearing to some of us. Because when he came, or when he comes to camp, he makes sure we eat on time, he makes sure we sleep on time, and we weren't used to those things. So a lot of people didn't get it. What this guy, what does he want? Why does he want me to sleep? And he will come literally and come and turn off your lights. You turn your light off. He wants you to sleep so you can have energy to play the game the next day. Some of us took it okay. Some people didn't take it, lightly. They were like, wow, he's too controlling. But for me, he was the best captain. And then, on top of that, when we went to play on the field, he was better than all of us. I mean, apart from him being the captain, he was so good. Some of you saw him. Some of these you young guys, you might have seen what Abedi did. But it's unbelievable. Yeah. And even the matches, you don't see anything. You have to come watch him in training. Okay. It's amazing what he does. And you look at him and you would want to be the same. And those days he was trying to teach us how to be professionals, but some of us didn't get it. Some of us did. And the people who didn't get it were the ones who had problems with him. But for me, I think he was a great leader.
Okay, so that's Joe Ado's take on
let's see if I can break it down quickly.
Yeah.
Right. He was the best player at the time, no doubt.
No doubt about
Won the Champions League, must say. Great stuff. CAF Player of the Year 3 times. Abedi Pele was definitely the man to go to. I mean, most have said that if he played in the 1992 final against Ivory Coast, would have won it. There wouldn't have been a need to go for penalties when we lost to Ivory Coast. So when it comes to what he's done on the pitch, nobody can talk about it. And remember,
but I guess the captaincy is more about the leadership.
That's what I'm going to. Yeah, that's what I'm going to. Because you see, since he won the CAF Football of the Year award in '93, no player has done that till date. Now that tells you something.
Yeah.
But I think in the life of every captain, there are 1 or 2 incidences that you may try to overshadow what it is. So if you look at Abedi Pele, I think that the captaincy row itself, knowing that Kwesi Appiah was then the captain of Kumasi Asante Kotoko, that's a huge following, and I'm sure a lot of Kumasi Asante Kotoko fans will be very, very, angry that Abedi Pele, taking the captaincy away from him. So maybe that was one of the things to look at. Now, I don't know exactly what was happening between Abedi Pele and Tony Yeboah. They have really not come out to say that this was the issue, but you could feel that there seemed to be that. And he was giving us an idea of what was probably going on in the team. But others believe that Abedi was doing the right thing. Others feel that he had so much ego. And look, my friend, whatever the case is. But he says the truth is, he was a good footballer. So if you take Asamoah Gyan as a captain of the Black Stars, there are 1 or 2, 3 incidences that will make you feel that, no, this guy cannot be the best captain of it. It's when you look at Stephen Appiah, he didn't have so many issues.
Exactly.
And
but
the fact that he qualified, he was a captain when we qualified for the World Cup for the first time, also breeds a lot of, this was just what we're looking for.
So, George, I'm sure someone is watching and saying that, oh, look at these young boys. You don't know the politics of the time, in the camp and all of that. But you see, the mere fact that post his active play, you still have issues of his leadership, still issues of how effective he was. I mean, I think that is a problem. Because usually when you are in there, definitely you're going to have issues, you're going to make enemies and all of that, especially when you want to be professional, like Joe was saying, and people do not get you. But when you have left, people should see what you were trying to do and should say that was the guy.
You think that people still couldn't see? So
I think that's still a problem.
I think we have to put it out there. So who was your best, or who is your best Black Stars captain?
Well, as far as I know,
you, Stephen Appiah. And you see, the Stephen Appiah one, I understand Stephen Appiah did well, but it's because we all see Stephen Appiah to have been the guy around when the Black Stars qualified for the World Cup, which was what we were all chasing or looking for.
Not necessarily. The guy commanded respect.
Commanded respect, and he kept the team together.
Exactly.
And they did so well during his time.
Yeah, that's it.
Well, it's a big one, but I think that's certainly a
so Abedi is a great footballer, no doubt about that.
But you don't think he's?
But I think that Stephen Appiah cuts it.
Well, we still have a lot of work to do, especially when we go to the 60s and the 70s, those who won something, because we're captains who led the Black Stars to win the Africa Cup of Nations trophy itself. We did that 4 times.
Well, so that is another argument.
And then there was a Black Stars captain who was so good himself that won so much of laurels, and that's Abedi Pele. And there was a Black Stars captain who was not maybe the star of the team, but he managed to galvanize a team that did wonders by going to the 2006 World Cup and 2010 World Cup.
George, I'm sure you can continue on and on and on.
So the question
let's do this on social media. What do you think? Who's your best Black Stars captain of all time?
So far,
let us know. I'm sure we'll have this conversation on radio as well. But that's it for News Desk. Thank you, George, for sports, and thank you for joining us. Up next is COVID and the Law. Please stay tuned in.